Good. And Matt Ajluni, Matt, you want to say a little bit about yourself? I know we've worked together over the last couple of years on some projects that you're working on. So maybe you could describe what you do.
Thanks, Rob. Yeah, good morning, everybody. My name is Matt Edgelooney. I am a family physician by training, but I've spent most of my medical career in urgent care and emergency room. I'm originally from Michigan, Detroit area, then trained and did most of my early work in Chicagoland area, working in ERs and urgent cares there. And then 10 years ago, I took the position that I'm currently in, which is the lead for IHA, which IHA is, many of you know, is a member of Trinity, just like St. Joe's is. So we're all part of the same family. But I've been in charge of their urgent care program. When I started, they had 3. We now have 14, and spent the last couple years, doing a lot of COVID work around as the urgent cares have been a prominent part of testing and things like that. So, yeah, that's about my story.
Thank you for joining us, Matt. I know you've been part of Leaders Connect a little bit, but this is your first presentation, I believe, or maybe the second. So glad to have you on board. And Suzy, you're out there, Suzy Fancoeur.
I'm out here.
Hi, Suzy.
Hi, thanks for having me this morning. So, good morning, everybody. I'm Suzy Fancoeur. I'm a physician assistant with IHA Urgent Care. I've been a physician assistant for 15 years now, originally in occupational medicine, and then over the past 7 years, I've been in the urgent care at IHA. Over the past, I'm coming up on 2 years now as the associate division head under Dr. Ajluni. And over the past almost 2 years now, I've been outside working, indoors working, and with the pandemic.
So you've been on the front line, Suzy.
We have.
What's that like for you? I mean, after 2 years, how's that been?
It ebbs and flows, right? So in the beginning, we were gung ho and ready to go and get out there and do what we needed to do, and we've faced the challenges that have come our way. We've learned a lot along the way, and right now I feel like we're resilient. We're our 4th surge here, and as we face this, I feel like we feel more prepared than ever because of what we've done in the past.
Well, I appreciate everything you have done. And you said the 4th surge at this point.
Is that correct?
Yeah.
You lose count after so many times.
I think that must be difficult. Well, we'll get back to you in a few minutes, Suzy, but we're going to go in the order of Rob and then Matt, and then we'll have Suzy talk about the front line. So Rob, you want to kind of give us an update? You've been through this as a supervising ER for several years now, and maybe you could just give us an update on what you're seeing. What we're going to try to cover today is 2 topics. One is what people are experiencing, what we can think about for the future. There seems to be quite a few people differing opinions about that. And the other topic we want to talk about is the stress on the healthcare system, and give us some frontline views of what that's like. And then we have several people who are in the medical field that I want to encourage to join, as they have something to add to it. We also are going to use the chat feature. So as you have questions or you want to make comments, please use that, and we'll go from there. So Dr. Rob, you want to start?
Sure. Yeah. So, the challenges have been different. 2020 was about volumes dropping 50%. People were staying home. So the challenges for us really were, finding enough hours for providers, having to cut hours. So providers had a different problem that they do now. 2021 has looked much different. So, volumes came back. So we're about up to 90% of what we saw in 2019. Patients are sicker on average. We've had a lot of operational issues, mostly because of staffing. Nursing staffing is a huge issue across the country. and physician staffing too. So the statistics show that in 2020, 1 in 5 nurses left, or 20% of healthcare workers left the industry. And there was a recent survey from the American Medical Association that said in the next 2 years, you're going to see another 1 out of 5 physicians retire or leave practice, and another 2 out of 5 nurses leave. And so that's been our big strain, really, from my perspective, for the last 6 months or so, is trying to sustain, operationally, an emergency department and hospital that works with very limited staff. So there's some extreme examples. I have a hospital that I recently had to terminate our contract because they were only able to supply 1 nurse for a 30-bed ER. So if you can imagine having 1 nurse for 30 or plus patients. And we just said, we can't, that's not sustainable. We can't provide, quality care and safe care in that environment, and had to terminate that contract. And I don't know if that hospital will be able to stay open. I've had more of my providers leave in the last 6 months, leaving emergency medicine completely or medicine completely, than I have in the first 20 years of my career. A lot of the baby boomers like myself tried to retire early. Advanced practitioners, so nurse practitioners and PAs, many of them, because they had their hours cut that first year, really see emergency medicine as not as desirable as they used to. And so we're really having a hard time hiring in senior nurse practitioners and senior physician assistants, and getting a lot of new PAs and new nurse practitioners, but with no previous experience in emergency medicine. So those are our big challenges right now. And we've actually had discussions with some hospitals that, especially now with
Rob, you're on mute.
oh, sorry, I don't know how that happened. What was the last thing I said or you heard?
You were just talking about you said we had some hospitals that, and then I think we lost you at that point.
Oh, yeah, I have some hospitals I've had a discussion with that there may come a day when I don't have a provider to come in to do the shift. We're seeing a lot of breakthrough with Omicron. So providers who are fully vaccinated and boosted are getting sick. They're not getting really sick, but they are positive, and they're being pulled off the roster, for 5 to 10 days. And that's creating additional staffing issues. So it's a place where I never thought we would ever see ourselves.
Rob, just those statistics were pretty astounding about how many people are leaving and have left. Could you just repeat those?
Yeah. So during 2020, according to the statistics, and I'm trying to remember, I think it was John Hopkins, 20% of healthcare workers left the industry. And then the American Medical Association just had a survey that came out that showed that in the next 2 years, 1 in 5 physicians intend on leaving practice, and 2 in 5 nurses intend on leaving. And so this is going to be going on for a while.
Wow. So what solutions are there possible for this?
Well, I know that some systems like Henry Ford Hospital has brought in nurses from other countries. So I think they brought in a large cadre of Filipino nurses, but you're getting nurses from other countries, like some of the European countries, which is okay for us. But, of course, we're causing a problem for other countries where they're having, worsening shortages. So I don't know how sustainable that is either. The going rate for nurses right now, I have some nurses who are being offered $5,000 a week to travel and go and practice somewhere. And so it's been really hard for hospitals to to be able to compete with that.
Wow. It's pretty incredible. Yeah, so it's breaking their budgets as well then. We're going to go on. Thank you, Rob, for that input. We're going to hear from you later, but I want to go to Matt. Matt, I want to say your name right. Edgelooney, is that correct?
Looney, Ajluni.
Edgelooney. Okay, sorry. Matt Edgelooney, who is the head of urgent care for IHA. Do you want to give your perspective on what you've seen happening?
Yeah, thanks, Rob. Both Robs. Just to kind, I mean, there's so much to talk about, but to kind of give you a couple pearls, maybe surprising or not surprising, but we're in the worst, as an urgent care program, we're in the worst phase of the pandemic we've been in from the beginning of the pandemic. It is our busiest, most crushing time, not necessarily from a sick acuity. We're seeing lots of dire patients, but we're seeing volumes that have exceeded anything we've seen going all the way back to, March, April, May of 2020. So we're stretched to the maximum as an urgent care program, as I think many of the other area places are, and it's mainly the testing demand. We have patients literally lined up. Either we have drive-through sites and we have walk-in sites, and any of you who live in Ann Arbor who drive by 242 Church on Wagner Road, where they do testing there, probably have insight. I mean, that's not our operation, but just as a example, you see cars snaked for all over the place. Every day you drive by there, 7 days a week. And so people are, you don't just have a cold anymore. When you have a cold, you got to make sure it's not COVID. So we're seeing every sniffle and sore throat that that anybody has is coming in to see a doctor. I just want to make sure this isn't COVID, but that puts a significant strain on us. We still have to take care of these patients, examine these patients, test these patients. And our teams are, I have, this will sound extreme, and you might look at me and say, why would you ever subject somebody to this? But we have our providers that work in the drive-through. The other day, one of them single-handedly saw 145 patients through the drive-through. And just to create a chart on 145 people, let alone not talk to them, examine them, take a history from them, would be a challenge. So, Suzy and I, as leaders of this program, are trying to figure out how do we effectively take care of our communities, but also keep our troops from collapsing. And, similar challenges that I'm sure Rob has in the ED with sicker patients. And staffing has been an issue. One, just finding bodies, and then two, the bodies we do have are going out with COVID-19 left and right. And so it's kind of every day is a new adventure just to get from open to close. Rob, you don't have the luxury of closing, but we're open from 8 a.m. until 8 p.m. So when 8 p.m. comes every night, I'm like, whew, we can, try to retool for the next day. Yeah, it's been a struggle, Rob. I think my sense is that Omicron is running wild. It is, people have used the analogy a forest fire. And I think that's an apt analogy in terms of how fast it's spreading. The good news is I think it's not causing as severe disease as previous iterations of it. But it's entered my house as of yesterday. My wife tested positive, so that was
dear, sorry to hear that.
But she's doing okay. It's not we're fortunate that we're youngish and healthy-ish and vaccinated fully, that we'll probably do fine. But it's the fallout of it, as many of you know. It's the notifying schools and contacts and everybody and quarantining and figuring it all. It's a big upheaval. And I think that part of it will probably go away pretty soon. The CDC has reduced their, made their guidelines less strict, which is a degree of controversy around that. But I do think that's the direction we're headed in, is getting people back into the general populace faster. And that will also, I think, reduce the strain on us to a degree, because not everybody's going to be running the test. If you've had symptoms for 3 days and it takes 2 days to get your PCR test back, and the quarantine period's only 5 days, then why the heck do I need to go in? I'm just going to stay home and rest. And when 5 days is over, I'm going back the way we did it in the old days. You got a cold, stay home, go back. You don't have to run to the doctor for a test and run to the pharmacy and test 47 other people. And, you know, the anxiety and testing craze is, I think, is a bit crazy to a degree. I understand that there's significant disease that people can get, but it needs to be dialed in a little more smartly. So I don't know. That's a bit of my thoughts this morning, Rob. I can share more or
Yeah,
less.
I mean, I think people are certainly confused about how much exposure to other people we should have. And, you know, I know we've been told all the things about masking, but we hear stories of breakthroughs even with vaccines and the boosters. You know, for example, I'm supposed to have a physical therapy appointment this afternoon. I'm conflicted about, do I go in to see the physical therapist? And she says everything is fine there. But, you know, it's not critical I get physical therapy today. And I'm thinking, you know, at my age, I just want to stay home. And plus we have a newborn baby in our family that we see, and a 99-year-old person we see. So what do you say about how to assess risk, and, you know, how much you should go out and be exposed to people?
Yeah, I mean, that's a tough question. I feel like I've gotten those questions from family and friends from the beginning of the pandemic. Should we let our relative come stay with us from California? Should we do this? Should we go there? And there's no easy answers. I mean, I think in the post-vaccine era, we should all have a lot more comfort knowing that they work pretty damn good. And now that doesn't mean that you can't still get disease, and you have to assess your own risk factors and your pre-existing conditions and how much risk you're at. I did hear, you know, when I mean, again, the vaccines work really good, and we're talking about people's appetite for risk. I heard one poignant comment from somebody that said, when they were discussing who should get boosted and who shouldn't get boosted, and we were talking about this otherwise young, well, I think it was pretty clear that the over 65 and people with comorbid conditions, at least initially, should get a booster. And now they've, of course, expanded that and said everybody 18 years, or I think 12 years and older should get boosted. But one commentator said there may be more risk of the 30-year-old driving to get his booster and getting in a car accident, higher risk of car accident and death from car accident, than there is from him dying from COVID without that booster shot. So that's the kind of risk that you're parsing out, because, you know, when I was assessing my benefit to get the booster, I was starting as a 46-year-old with 2 shots on board. My risk of ending up in the hospital with severe disease was something like 1 in 10,000. And don't quote me on those numbers, but they said, but if you get the booster, you'll decrease your risk 10 times that. So now I'm at 1 in 100,000. Well, maybe I was okay with 1 in 10,000, because there is some associated risk with getting the booster. So I know it might be a convoluted answer to your question, but there is this risk assessment we're all doing. And you know, at some point, life has to go on, and your physical therapy is probably pretty important to your overall quality of life and your, you know, moving forward on whatever you're working on. And, you know, maybe that's worth the infinitesimal risk that you get it. And I'm sure you're fully vaxxed, and if you did get it, you probably do fine. I mean, so that's the best I can do for you. Some of that.
Okay. Well, we're going to move to Suzy Fancoeur. And Suzy, you're on the direct delivery of service, unlike Matt and Rob, who do it occasionally. But were you one of those people that 165 patients the other day?
Well, That wasn't me who was the 145 or 165. I saw 102 on Monday by myself in my 12-hour shift.
Wow. So what's that like? I mean, I can't imagine that's 10 and over 10 an hour. I mean, what are they coming in for? What do you do with them?
Majority are COVID tests. Right now, we're starting to see some integration of true urgent care visits as well. So ankle sprains, last things like that. I would say probably 90 to 95% of what I did that day was COVID testing. But as Matt said, you have to evaluate all of those patients. And we've said throughout when we started drive-through testing and COVID testing is we're looking for a needle in a haystack. What that means is every patient that's coming in with COVID tests, we have to have this level of suspicion to watch to make sure we're not missing a larger problem or more significant medical problem. So we have, as I said, we have strong teams. We're fortunate in that way. So working on Monday and seeing 102, I had really strong support staff, and having that made it a lot easier, but still daunting. I didn't go to the bathroom that day. 12-hour shift. I didn't get to eat lunch during that 12-hour shift. You don't get to drink a lot of water, things like that, because you have PPE on. And that's not to say we're not allowed to step off the floor. Dr. Ajluni encourages us to take time to take breaks and things like that. But Rob can probably tell you too, in the ER, you get very little time when you're trying to see that volume.
So what do you all do to keep yourselves healthy? I mean, I can't imagine. Has it have you had the virus? How are you doing?
I've not had COVID. I've been fortunate that I know of. Things that we do, I mean, for our staff, we always encourage them, in terms of their downtime when they're outside of work, obviously eating healthy, getting lots of rest. While they're in clinic, we recently implemented bringing in lunches and breakfast for them to help them, because it's not always easy to get off the floor and get something to eat. So for the next few weeks, they'll be getting lunches and dinners and things like that to help out.
Is that something often I hear? What could we do to support people? People, and early on, people were trying to send food, and is that still something that is appreciated and possible to do?
Oh, absolutely. We talked about this recently, and I think that's some of the impetus for doing this again. At the beginning of the pandemic was much easier because we had all of this community support where restaurants and business owners sent food and things like that. That made it easier to get through those large volumes. Now we didn't see that as much, but we implemented it as a program, which I think helps the staff and it boosts morale and helps you get through those long days.
Okay. Well, it sounds very stressful, and I can't imagine this. It's stressful like this month in January, but it sounds like you say this is the third or fourth wave of this. So, do you find that a lot of people are leaving? Do you know folks that are just getting out of the field and just exhausted? What's the percentage of that of people?
I feel like we saw more of that earlier on, where people were scared of COVID. Some of our staff, they had the option to stay home and not work. I think we see less of that now, and we're kind of rebuilding our troops. I mean, the problem is that we don't have many applicants, so not many people are joining us. But right now, we're fortunate not having a ton leave either.
Okay. Do you see children too, or do they go somewhere else? Do children go to urgent care facilities as well?
Yeah, we see all age groups.
What are you seeing in children?
For the most part, we're seeing a lot of COVID testing, but also ear infections. We're starting to see a little bit more of the standard things: strep throat, hand, foot, and mouth, as we've integrated people back into schools and going around each other again. So a little bit more of the typical stuff. We saw a pretty high season of RSV and bronchiolitis in the past couple of months. I think a little bit higher than usual. But those are the main things that we're seeing.
Okay.
But the ones that we're seeing with COVID, Rob, are generally doing fine. I mean, obviously there's kids hospitalized with COVID-19, but in the community clinics that we're seeing the kids, they have sniffles and just common cold stuff, and they're positive for COVID, and they otherwise are doing quite well. I mean,
Okay.
I'm not trying to minimize that a kid could get severely sick from COVID, but it's the very, very small minority of kids.
Okay. That's interesting. Rob, what do you, I know you have some emergency rooms for children too. What are you noticing there, Rob McCurdy?
So we're not seeing that big of an uptick of admissions, even with Omicron, but from what I've heard in New York, that they are seeing probably a 1% increase in the number of kids who are being admitted. So I think it's with Omicron, because it's so contagious, you're just getting a huger volume of patients being infected. So you expect to see some increase in hospitalization, but you know, I don't think in general they're as sick as the patients with Delta. I did want to comment on the testing issue that Matt touched on. So, you know, that's been a major failing of our government, is that being able to provide enough testing, and that is directing patients to come to, you know, the ERs just to get a test, and to the urgent cares to get testing. Because, you know, right now, if you try and look around the area to try and schedule a test with like CVS or Rite Aid, it can take up to a week to schedule a test, and there's nothing available, you know, for home testing. You know, you might get lucky and show up at CVS after they've had a shipment. It lasts for like 2 hours, then it's gone off the shelves. And so, you know, that's one of my big really concerns, is that we have not been able to provide enough testing for people to get, and now they're feeling like they need to go to the hospitals and urgent cares to do that, and that's part of what's overwhelming us.
So one general question, I read this morning that there's a group of experts. These experts formerly work for CDC or other places like that, and they're saying we should kind of back down on all this work of trying to prevent, and start treating this a lot more like we would the seasonal flu. What are your thoughts, all of you, about that? I mean, are we getting to the point where we shouldn't be so freaked out about this, making such demands on ourselves to, you know, not go into a restaurant or whatever it is that people are doing to restrict themselves?
That's a great question. I don't know. There's so much information and disinformation out there. It's hard to get anyone and everyone on the same page as far as what to do. So you know, I'm not an expert. I try to, you know, follow what the CDC is saying. So I don't know the answer to that long term, but I understand why people are asking that question.
Yeah, you seem to have some ideas on that, maybe more toward that direction of beginning to accept this as something that's out there, may be out there for a while, and we can't get as worked up about it. Am I correct about that?
I mean, my sense is that when we get, as Omicron burns through our society, and we end up with either a huge percentage of vaccinated people and or people who've had the disease, the risk should be greatly reduced on people ending up hospitalized and with bad disease. You know, right now, most of the people in the hospital are the unvaccinated, which is what's putting the stress and strain on our healthcare system. So if all those unvaccinated folks start getting the disease and now they do have immunity, that should help. So again, I'm not an expert either, but my sense is that when we get to this narrowing percentage of people who've either never seen the virus or have not been vaccinated, we should be in a better place. That percentage should get really, really low. Now, I guess there are examples, and Rob, you might have more insight into this than I do, of fully vaccinated, and I've heard them anecdotally, but fully vaccinated, 3 boosted shots of people that end up still in bad shape. But there's also examples of that with the flu, of course, you know, that the vaccine is not entirely effective, and you can, as a elderly or high risk person, you can end up hospitalized. So yeah, I do think we're headed in that direction, Rob. I just don't know when.
All right.
Yeah.
Rob, you had but let me go to Suzy about that. Suzy, did you notice that people, I don't know if people come in for the vaccine to your clinics, but do you see they don't?
No, they don't.
Okay, because I guess the question I have, and it may be more general, is there any increase in the people who are unvaccinated deciding to get vaccinated? I mean, I certainly heard a lot of stories where the unvaccinated are getting the COVID, but I'm wondering, do we see any tipping point of the people deciding that maybe their stance is not the correct stance, and they're shifting over? I don't know if anybody has data on that.
So I don't have the data on that. I mean, people are still continuing to get vaccinated, boosted, but in terms of people shifting their opinion, I don't have a good answer for that. Maybe Rob or Matt.
Rob, say that question again. Sorry, I was answering.
Well, are the unvaccinated getting, is there any changes in the unvaccinated where people are beginning to shift and say, hey, maybe this is a good idea, and they're coming for vaccinations?
No.
No, okay.
No. You know, I just saw an interview with some woman who'd been in the ICU twice for COVID, and she still insisted that she was not going to get a vaccination. I have a family member who refuses to get vaccinated because she thinks, well, I've already had it 3 times, which she has no proof of that. She just thinks that. And so she says, well, I'm already, you know, immune, so I don't need to get the vaccine. So
Yeah.
I'm not seeing that the people who have said that they're not going to get vaccinated. I think the only people that change their minds are if they have a close family member that gets seriously ill with the virus.
Yeah. Well, it's fascinating how this seems to be following, and at least in my opinion, a lot of the political standoffs that are happening. So this has become a very politicized event, which is fairly. I think it's totally novel. I don't think this has happened before. I'm going to shift to some questions here. We've got lots of people on the question board, so maybe for the next few minutes we'll have people ask some questions. Mary Martin, are you out there, Mary? Hi, Mary. You want to pose your question, and are you still? How much snow do you got there in Holland? I don't see Mary at the moment. How about Deb Orlowski? Are you there, Deb?
Oh yeah, I'm here.
So what's your question, Deb?
Well, you know, I think it's very, I'm intellectually understanding what Matt's been saying. I'm emotionally pretty upset right now because I have a 4-year-old granddaughter and a 9-month-old grandson who has tremendous diarrhea. They can't get him to drink anything. It's terrifying. And everybody's been boosted. Everybody's been boosted. Everybody's been vaccinated. Both of my son's best friends have had COVID, and same situation with them. Someone I work with had said yesterday she and her husband are feeling terrible. I mean, not terrible enough to go to the hospital. But I guess my point is that I think people are trying to do the right thing, getting vaccinated, getting boosted, doing everything they're supposed to, and yet everybody's fatigued. I mean, the providers are fatigued. I know somebody else who needs an emergency operation, and there are no ERs for them. So, I mean, people I think are getting fatigued with trying to do the right thing, which kind of scares me in terms of what's going to happen next, because is everybody just going to throw up their hands and go, why bother? You know, this is crazy. And so I understand intellectually the way the virus works, the way immunity works, those kind of things. But it just seems that even when you are doing the right things, it's not really making that much of a difference in what's going on with the virus. And I would just like to have one of the 3 or all 3 of you, address that sort of mental fatigue that everybody is feeling about, even when you're doing the right thing, it's seeming to be not the right thing, except we're not in a hospital dying of it.
Yeah, no, I get totally what I think in a lot of cases, people have kind of just thrown up their hands. I mean, in my community in Brighton, you don't see a lot of people wearing masks, not compared to being in Washtenaw County. and people are crowding the bars and crowding the restaurants. So I think a lot of people have just said, you know what, I'm done with this. I'm just going to go on with my life. You know, and your other point is that people who have emergency conditions totally unrelated to COVID are suffering and not able to get the care that they need because of, you know, the staffing shortages and the overcrowding that's caused a lot by the people who refuse to get vaccinated. So that's really frustrating for us providers on the front line, that we can't get to those people, can't get to people like strokes and heart attacks and that kind of stuff, that we used to, you know, provide exceptional care for, and now it's not so exceptional, and there's really not a lot we can do about it.
I know several people in that category myself, and it is kind of tragic if you have something else that needs care. And not only that, but you wonder about the quality of care. If people are so burned out, are they getting the kind of attention that normally they would get? So that, I mean, I don't have any data on that, but you know, anecdotally, I've heard that. I want to turn to Ginny.
Can I just say one thing, please? Very quickly, I just want the people who are associated with IHA to know that since the beginning of the pandemic, the few times I've had any kind of contact with the IHA people, they have been absolutely stellar. So even though you all are burned out and you're feeling horrible, you are amazing. You really are providing exceptional care. So thank you very much.
Well, that's nice of you to say. I didn't know where you were going with that, but I'm glad that was a positive. I know you're a positive person, Deb. And so I want to go to Jenny Crispin, because Jenny, you're at the VA and you deal with a different population. I wonder if you could give us perspective from that point of view.
Oh, sure. A couple of things. I think I agree with that. All that's been brought forward. You know, right now we're looking at 120 employees out of the healthcare system, you know, post the holiday season. And I think it is part of it's contributed to that fatigue.
How many, what percentage is that, Jenny?
That right now.
That's just at the VA.
Yeah, that's just at the VA. We have 120 that are positive. We have 140 out of the system. But I think that as people brought up, it's related to the fatigue, and people are there are not the safeguards that were in place before. So we too have similar situations, like trying to figure out what services to provide, what surgeries to bring forward. We are actually preparing based on what we know from following what has happened in Ohio, where, for example, the Cleveland healthcare system had at one time 700 employees out of 5,000. So that's pretty significant impact on your ability to provide care. So we're actually preparing to address that, what we refer to as contingency staffing as provided by the CDC guidelines, and moving forward for that. We actually, I feel for the ED department, we have the similar situation. We might have our ED visits, which are still going strong, and we have deferred care with people a little bit more acute than we've seen before, finally coming into the healthcare system. So that's impacting our ED department, in addition to having a testing. And we test for veterans coming in for procedures and so on and so forth. We test employees that are not vaccinated. And we also we saw the recent surge of folks coming in post holidays for testing. And I will tell you right now, 1 in 3 are testing positive, and are whether it be employees and or that present for testing. So we are working through those issues. I will tell you, in our patient population, though, even though we find, and we've been able to demonstrate that if we do get them fully vaccinated, which includes a booster, they might get sick, but they're less likely to present to our for acute admission. And all my employees that have been admitted at one of your other at the offsite facilities were unvaccinated. So we've been able to, really kind of push with the vaccination. I would say we're actually experiencing the struggle with people not wanting to be vaccinating and might have to leave our facility. I don't know where they're going to go, because I believe all of you have mandatory vaccination expectations too. So we're working, a lot of what you all brought up from the ED perspective is what we're experiencing too, a higher volume of acute patients presenting just for, as you've indicated, heart attacks, strokes, general needs, and trying to weigh the balance of that with the population of COVID positive employees and how do we provide those services going forward. Our population tends to be a little bit older than the community. And I will say though, one of the things that we are able to do very well, we've been able to maintain our vaccination clinic here in town in the office, and our turnaround for testing is less than 8 hours, which is actually beneficial, especially when you're working with an employee population. You can bring them back in a more effective and timely fashion. But that's been really positive, although we are starting to see some shortages out there in the testing equipment available. And then having those people that are available. I will say we've actually started what we call detailing employees to support things like employee health, ED department, testing. What I've seen also across the system, we talk a lot about our frontline providers, but one of our biggest limitations throughout Indiana, Ohio, and here has been medical technologists for the lab. And so, you know, those support services that help you be successful, the folks that pack your parachute are you know, some of the things we're really watching, because this will impact our ability. You know, if I don't have a lab up and running, I can't do surgeries, I can't do other things. So we're really fortunate. We've had to detail folks and bring folks from other areas to support us in meeting that. But right now we're holding strong. Our census every day is between 95 and 100%. We've had to close some, not close, I don't know how to say it, but we've had to close to admissions because of positive either employees or patients in different work areas. And so we've had
just in terms of background, I'm sorry to interrupt you, but I didn't introduce you. You're the CEO of several VA hospitals. Is that correct?
Yeah, I'm the CEO here at the VA Ann Arbor Healthcare System, which has about 9 clinics and 1 hospital, but I'm also the leader for the Michigan market, so the 4 facilities in the Michigan market. So we all work together, which is just like any other healthcare system. So
yeah. I haven't heard a lot about, you know, how much this is affecting the veterans, because I would think, especially with the Vietnam vets who are now you know, all in their approaching 70, if not beyond that. I mean, some of them probably 80. You know, a more at-risk population, maybe a poorer population in terms of my perspective. Homeless has still affected that. So how about for these people that are older, very sick? I mean, are they? Is it worse for them? Are you having to send a lot of those people for emergency care, for ventilators and things like that?
So we have the resources and we're able to provide the vaccinations, and we've been very fortunate. Actually, this week we're doing a booster blitz to reach out to those 16,000 veterans that haven't been boosted. Yes, it is. So interesting from my perspective, from a personal perspective, and from an employer perspective, we really encourage vaccination and mask wearing, regardless of where you're at, because of the older population and the impact that it could have on them. I would say what's impacting our older veteran population, though, is the ability to get into either our system or say one of the systems in the community due to the COVID and limitations employees and limitations of services that can be provided right now, meaning they might need a hip replacement and I can't provide it right now in my facility, and maybe St. Joe's can't provide it for them either because of the impact. So we refer to deferred care, people that have been waiting for a hip replacement, people have been waiting for resources. That's where I see the COVID is having the most impact, is the ability to get them in and get them seen, and having to reprioritize and to get folks in. I don't know if you're experiencing that at your facility in St. Joe's, but I think that's where we're seeing the impact of COVID is actually impacting this population that needs services that are limited or either in the community or our facility as we work through this 4th surge. Does that help?
Yes, for sure. Comments from the other speakers?
Just going to comment on what Debbie had said about, you know, people doing things right and they still get COVID. And just from a provider perspective, you know, I spent a lot of my shift trying to convince patients of which tests they need. And so I think that it's difficult for the general population to know like what quote unquote right is. Like they get pressure from employers, they get, you know, they want to go see grandma, things like that. And I think that kind of contributes to some of the problem that Debbie's talking about, where you thought somebody got tested that they could be out of quarantine. And lots of times we have people that are, should be in quarantine and didn't get, maybe they got a rapid test and they needed a PCR test and they went around other people. Anyway, that was just a comment.
Thank you. I'm going to call on one of our participants in the audience today, Jane Dutton. Jane, are you out there? I see you unmuted, but I don't see your pretty face. Is that no camera today?
No, I'm
What?
here. I'm trying
There
to
you
do
are.
all
There you are.
things while I'm listening.
So Jane, I just wanted to ask you, you've studied a lot about the effect of different things in the workplace. And one of them, I think, is compassion fatigue. Do you want to comment on what you're experiencing or what you're seeing or what compassion fatigue is?
Well, I mean, it's being burned out on your capacity to both sense and respond to human suffering. So that's, I just want to send out my deep appreciation. I can get totally teary for all the people who are working on the front lines with this, because it is relentless, as people are talking about it. I hope these different hospital systems are actively engaging. I mean, what our research would suggest is that there's a lot of additional things that need to be done to resource people in the face of this compassion fatigue. And so I don't know, where the hospitals are so overwhelmed, I'm not sure what various leaders are doing in different locations in the hospital to replenish and actively try to nourish people in the face of this compassion fatigue. I mean, there are things that can be done to help resource people. And so sometimes I think it's a limit of our imagination about how systems can take small actions that are deeply replenishing, like doing things that just facilitate people feeling appreciation, like real appreciation, like having daily doses, micro moments of replenishment. So I don't know if that helps. I guess
Well, I want to add, let me go to Rob, because he's probably most connected to that. Rob McCurdy. Again, I want to reintroduce Rob. Rob is he is regional director, I believe, of Envision Health Emergency Department. So you cover several hospitals. How many, Rob, do you cover?
Up 40.
40. Okay. So in terms of that, what hospitals are trying to do to support their staff, or what you're trying to do in your company, how would you think about that?
I mean, it's hard to say what the hospitals are doing. I would say my company Envision has lots of wellness resources for providers. The thing is getting them to use it, so physicians and advanced practitioners are not really good at self diagnosis and realizing where they are and being burned out. And it's hard to get them to use the resources. So in addition to that, we try to encourage dialogue at department meetings about how people are feeling, just so people can be open and transparent about what they're experiencing, that it's not just them, that everybody's having those same feelings of burnout and compassion fatigue. But there's only a limited amount that you can do to push on people. A lot of it has to be self-directed, and that's part of the problem.
And I know, working with you, Rob, and with Matt in the past, the fatigue also goes to your level. I mean, people think, well, the directors of this are not fatigued, but I know wave after wave of this must be affecting people who are in the leadership roles too. Can you comment on that, gentlemen, or Susie, or anybody else that wants to join in?
Yeah, I mean, I will say that I think about every month at least, do I still want to continue doing this? Because it is taking a toll on myself and my family. I just feel like if I step out of this role, is the person who's going to take over for me going to be looking out for the providers the way I try to do? And so I guess I'm using that as a way to try and stick with it. But it is, I don't sleep well. I don't feel well. It's, endless, it seems, and we don't have an endpoint. So yeah, it's tough.
I can comment too, Rob. I think actually for the first time in my career, this was a couple days ago, I was saying maybe this isn't worth it anymore. Not that I'm seriously considering that, but it was starting to really creep in, and it's it was just all of it. It's so much all the time, and you have providers that are leaving. I had 3 provider conversations in the last couple days ago who are all leaving for various reasons, and it's hard to take some of their hard to hear them talk about it and hard to hear their feedback. I will comment a little bit about the compassion fatigue and what we're doing. I read an article, an urgent care article a couple of days ago, and the author was talking about toxic positivity and this concept where the admins and leaders are saying, keep up the good work, guys. You're doing great out there. We got your back here, but not doing any substantive stuff like Jane was talking about. If I could just find his quote, he said, so if you work in administration and realize that you're guilty of practicing toxic positivity, replace token gestures with genuine expressions of gratitude. Your staff is more likely to push forward if the harsh realities of healthcare work at this moment in history are acknowledged. Clinicians are a resilient and self-motivated bunch. And when we are struggling, we don't need forced optimism. We need real support. And I've often thought about, I've penned so many emails to my providers and in meetings said, we have a section on our meeting agenda called the gratitude section, where we spend 5 or 10 minutes just saying, thank you. We know how hard it is out there. We got your back, and it couldn't be coming from a more deep-seated place for me personally, because I absolutely feel that, but is it falling on deaf ears? And so what are we substantively doing? And we're doing a gazillion things. I mean, we're trying to give more money. We're trying to give resources for wellness, like Rob described. We're giving lunches for the next, you run out of stuff to do. And I wrote back to the guy who wrote the article and I said, it's easy to pile on the admins. I mean, we're human too. And we're doing every damn thing we can do, but can't the situation just be bad? I mean, it's a bad situation. It's just bad. The pandemic is not good, and no amount of thank you, money, food, hugs can mitigate that. So it has to be an acceptance point. I'm a little sensitive when people are like, oh, the admins don't care enough, or you're just throwing false praise on us. No, I don't. I mean, there probably are people that are guilty of that, but I don't feel like I am. And I'll look inward and say, what can I do better? But it's just it's a crappy situation for all of us.
Suzy, I see you're nodding your head there. What as again the person who is right on the front lines and is trying to manage this, what are you finding?
Same thing as Dr. Edgelooney. I mean, I guess I feel like about the time that he's getting fatigued, I'm starting to pick back up, and we kind of trade off in terms of getting to that burnout point of, is this worth it? But like you said, like Rob and them both said, it's tough. It is, and it's hard to find those genuine ways to thank our providers and our staff. And we've tried different things. I mean, like you said, it comes from a good place, but I do think we do try to acknowledge too to our providers that this is tough, and our staff that this is tough, and we're going to do what we can to get through it.
So Rob,
Thank
could I
you.
offer something too?
Please.
So what I find different about this 4th surge is compared to what happened in March and April of 2020, we had the community behind us. We had support. People were, thought of us as individuals that are going out there and just really, and we were warriors, right? But now it just seems like it's a divide almost in the aspect, and you feel like you can't. So people don't. I don't think folks recognize it right now. It's worse than it was in 2020. Mm-hmm. And it's impacting our families, and we have this fatigue and this build on it. And my perspective has been getting the community to come together in support of us. And I will tell you, I read letters from our veterans just recently one, to my team, because they said they recognize that it's not good right now and with all the COVID, but they really appreciated the service they got. And I think sometimes we're not recognizing that. So it's very isolating is what I see for my providers and my whole healthcare system is that the community is really not in support of what's going on right now. They're very divided. They have their own fatigue, and that is making it a little bit harder. And that's just my opinion. That and $5 would buy you a cup of coffee.
Yeah. Well, that's really interesting. Not seeing just in general, people are getting very short-tempered with customer service. Just people blowing up at CVS over, not having their particular brand of soap or whatever. So we're all, I think, in this society, this idea of compassion fatigue. Everyone's trying to be supportive. Not everybody. I think there's also a divide between people getting angry at the non-vaccinated because I think they see this as continuing the problem. But we're at wrap up time, and I greatly appreciate everything people have said. And I think this has been a deeply moving conversation. And I just want to give Rob and Suzy and Matt a chance if you want to make a last comment to wrap it up. Summary of what you've been hearing today and anything you've learned maybe.
Well, I'll just comment. Deb Orlowski asked, what can we do to help providers? What can we do to help each other? And that's the $1 million question. I wish I had an answer for that. I guess when I work on the front line and what I hear from my frontline providers are the thing that makes their day is when, patients are still thanking them for the care they're delivering, even if they had to wait for 8 hours to be seen, to recognize that we're doing the best we can. And yes, it's not the care that they got in 2019, but we're doing the best we can with what we have. And I understand if you're not a healthcare provider and you're going about your business every day, you probably have no clue as to what it feels like on the front line and what it's like being a patient in the hospital. So I don't know. I guess just continued discussion and just talking about it.
Well, I very much appreciate your leading that discussion, Rob, and talking as openly as you have about it. So, and I wish you well. I hope you find some way to get a break. I know you like to spend some time in the UP. I have no way to understand that right now, but I hope you get up there with your snowmobile or whatever it's going to take. Suzy, do you have any wrap up comments, thoughts?
Yeah, there was a question in the chat that I saw pop up, said, what can you do as a community? Just we're promoting be kind, and we understand everybody, just what Rob said is everybody's fatigued, but understand we're doing our very best, and just encourage others in the community to know that your medical community, your medical providers, we're doing everything we can to help you out, and just be a little bit patient with us.
Matt, closing comments.
Well, Rob and Suzy said it well. We do have this Be Kind campaign at IHA, like many other businesses. You see signs around town. Please bear with us, and we're overstretched and strained, and it helps a lot. The people that genuinely look at you and say thank you. That it's very meaningful for me when that occurs, and I think we all have to pause and give thanks for the stuff we have. Right? As bad as it is. Most of us still have a roof over our head. Most of us still have food on our tables, and we have to just be thankful for the small things, and could always be worse. So that's kind of what moves me through day to day, and the challenges still inspire me to get up every morning and try to do better and lead our troops and keep putting one foot in front of the other. I think there is a light at the end of the tunnel here, in my opinion. I think this is going to get better. But I've been wrong before, so I'm not a good prognosticator, but I do feel pretty optimistic about 2022. So.
Good. Well, we're going to officially wrap up. There's a lot of great questions that we didn't get to, and I would hope if maybe people would want to, not that I want to overburden people, but send an email if you have a comment, or if you have a like Deb gave a shout out, because I know this means a lot. I wish we could get more to the front lines. One of the front lines I think that's affected, we don't talk much about, is just the drive-through at CVS, where they're sitting behind the shield there and they're giving test after test after test. So that's another place to hand somebody a drive-through. The other day I was at Tim Hortons of all places, and this was like 2 days ago, and I got to pay for my donuts, and the woman at the counter said, "Oh, the woman in front of you has already paid for you." Oh, well, that's very nice, but I'll tell you what, let me pay for the person behind me. And I paid for the person behind me, and then I stopped to drink my coffee, and the person behind me said, "Thank you for paying for me." She drove up to me and she said, "I paid for the person behind you." So I don't know how far that went, but paying it forward is another great way to do it. I think we all have to figure out ways to be kind and helpful to people, bringing food, saying thank you, any other ideas that people have. And I think this comment that today we've talked a lot about the compassion fatigue and about the front line, and I think that's great, because we've all tried to get information from the newspapers and TV shows and whatever about how to deal with COVID, but we haven't really focused as much on helping the people who are directly dealing with it. So I want to thank you all, and if some people want to stay on the line and make comments, I know people have to leave. Rob's got to get his car in for service. I imagine Matt and Susie got to get back to the work, but we could stay online. And if people want to talk for the next few minutes, we can. Those of you that want to sign off, thank you again for participating.
Thanks for the opportunity, Rob. Thanks everybody
Sure.
for
Thank you for coming.
your nice comments.
Jeff, let's see who ends up here. Other comments that people might have. I see Matt and Susie are staying around for a little bit longer. Somebody asked about long COVID and the effect of that. Even though things aren't as severe, are people who are not as severe right now getting the long COVID symptoms, as far as you know?
So I don't have a ton of insight into the likelihood of like a fully vaccinated person then ending up with long COVID. My sense is that it's greatly reduced likelihood that you would end up with those, but I honestly don't have a lot of insight into that. I think I'm sure I don't know that much about that. Susie,
Any other questions from the group that are on board, or comments?
Rob, I do. Jane, this is Jane.
Yeah.
So I put
By the
in
way, Jane Dutton is I guess a professor emeritus at this point at
yeah,
University
I am,
of Michigan
but
Business School.
yeah, and I just keep thinking about how other institutions as part of our ecosystem can play a role in supporting the healthcare providers now. And I just don't know. It just, I'm part of a Center for Positive Organizations where I feel like we're working with lots of different groups in the healthcare system, but I just think there could be a way that the university as an institution could play a more proactive role in supporting the different systems, but the people in these systems that are just so depleted at this point in time. I just, the university is dealing with its own issues about COVID and staying open and all that kind of stuff, but and our students are suffering. But anyway, I mentioned before the limit to our imagination. I mean, I don't know at the level of the community or the town or whatever would be the right place to convene conversations between different institutional leaders about how we can help depleted parts of the ecosystem during this time. I just know so that's just the question.
Well, this is Jan McDermott. I had put a question in there about what is it the community could do. Those of us who aren't in healthcare but have other resources or other networks that we could connect with to be able to help with the fatigue that these people are experiencing. Is there a way to organize some sort of gratefulness, gratitude showing to these people that we recognize the stress they're under and we appreciate? It's just right off the top of my head were women's organizations that I'm associated with. Is there a way to pull together something that could be delivered, given in some way, even if it's a card campaign, an email campaign, a donut campaign, a pizza campaign. I don't know. But we are all networked beyond Rob Pasick's Leaders Connect, and we're all networked in BNI and ActionNet and WXW and other Athena. Is there a way that we can coalesce here,
Yeah, well,
collaborate, cooperate?
Jan and Jane, I think, maybe we could discuss how to use Leaders Connect and try to get in some of these leaders to talk about more of what the community can do, because I think that's great to think about this as, we're an ecosystem. We're all trying to help each other. But what can the institutions that maybe have more resources do? And I think a lot of people who, let's say, work at the university don't know what to do, but maybe if they could contribute to something, a fund or whatever, that would be something that people could do. People contribute to the United Fund, and I'm not sure even if there was money what it could do, but certainly that's a great idea. Any other questions, comments?
Yes, I have a question. I have two questions.
Yeah, go ahead. You want to introduce yourself, Fran?
It's Francine Bomar. Well, first of all, I was really curious as to whether or not compassion fatigue has affected medical decision making. I heard a talk on NPR this morning, and they were talking about the situation where there's one bed in the ICU, and you have an unvaccinated person and a vaccinated person, maybe similar medical conditions. Does that affect the medical decision making at all, or has it?
And let me turn to Matt and Suzy about that.
So I'll just say, I don't work with the highly sick patients in the hospital. So that has not been in my personal purview. We've luckily not had to make decisions like that. I don't think at St. Joe's Hospital, as the hospital I'm most familiar with, they've been in situations where we're making decisions like that. I think they have been stressed and strained, but I do think they have enough beds to treat both of those patients. And I hope and do believe that they're giving the same care to the vaccinated and unvaccinated. I think we all are very frustrated with unvaccinated patients. That's something that I've really struggled with, is trying to push those feelings down when I'm in the rooms with patients that what I personally view as reckless behavior and kind of careless behavior, but I also try to respect their decision as best as I can. So I can't speak for the ICU doctors, but the ones I know adhere to the highest standards of our profession, which is our duty to, care for the sick in the best way that we can, irrespective of age, race, vaccine status, all the other variables. So.
Okay, Suzy, I know you had a comment on that.
Just a tag on to what Matt said about, I was just going to say the same thing he did, is that we don't generally deal with that, but it is, when we're in a room with a patient and somebody is angry with us about us telling them the quarantine guidelines are not vaccinated, it does become a difficult conversation, right? I respect their decision not to get vaccinated, but that's where I think we see the brunt of vaccinated versus unvaccinated conversations. Last thing I was going to say is thank you guys all for your compassion and looking at ways you can help us. That means a lot. I think from my perspective, being on the front line, the biggest thing, if we can spread the message, is, again, just be patient with us. I personally, I don't need a thank yous are great and we appreciate them, but it's not even about the thank you, and more the patience that we're all stressed and strained, and that we're doing the best that we can. If we can get people to understand that, I think that alone will help reduce the fatigue on our part.
Well, I'm going to be trying to summarize this myself, and want to introduce Megan Devrie, who is now working with me. Megan, you want to raise your hand? She's got my name because she signed in under my list, but we're going to work on this video over the weekend and try to get some of these ideas out to the community, and maybe ask for more ideas from the community of ways to support the ecosystem here that's trying to deal with this. So I'm really glad to be awakened to this, even more so than I was before. So I'll get that out to people on Monday, and we'll work on it over the weekend and see if we can get some dialogue going about specific things that could be done. I know a lot of people in leadership positions are reading this, and so hopefully we can get some ideas.